We had UPS and CVS, the CEOs of those companies, on air to talk about the expansion of their Access Point partnership yesterday. FedEx and Walgreens. Just earlier this week, Blue Cross Blue Shield of Massachusetts partnering with Amazon PillPack. How is this partnership different? And how does it speak to, a broader shift we're seeing in this industry?
Yeah. So I started Oscar 7 years ago because my wife was pregnant with our first kids, and I couldn't figure out how this worked. I'm a computer scientist. I thought I should be able to read the bills I get and the EOBs I get and so on. I couldn't really figure this out. And so Oscar, we started as a company that makes healthcare easier and more affordable. We built a number of unique features into the plan. For example, we have about half the membership in New York using telemedicine, which is about 10x more than any other insurance company has telemedicine utilization. And one of the magical experiences we will have that I think nobody else has is really you sit at home, you feel sick, you talk to one of our doctors for free 24/7, and the drug will materialize magically on your doorstep shortly thereafter. And that's, I think, a kind of seamless healthcare experience that is also more affordable because that is free for you with this entire kind of progression there that we think goes beyond what anybody else has built so far.
Yeah, and this initiative is starting in New York City, Eric, and I know this has been sort of ground zero for Capsule's efforts. How will this scale nationwide, and how does it speak to Capsule's expansion nationwide coming into 2020?
Yeah, so we built Capsule, started building Capsule 5 years ago. And the mission for the business has always been to build a pharmacy that works for everyone. And what we'll append to that is a pharmacy that works for everyone, everywhere. And so we're in the middle of expanding the business rapidly outside of New York City in all of the places that you would think we will be. And I think one of the most important things about being able to partner with Oscar and Mario and the team is really what we've invested in over 5 years is building out a proprietary technology system that enables us to partner with insurers, doctors, hospitals, and drug makers to build and drive better healthcare outcomes than have ever been possible before. So we're really excited for this to be one of the first things, and I think you'll see many more partnership opportunities to come through the platform that we've invested in over time.
Mario, is urban healthcare going to end up looking a lot different than other places? Because it seems like this CVS UPS thing around packages being part of it it's partly solving urban problems. And then when you got more density, it seems like the capsule solution might make more sense to people.
I think healthcare in the US is very local, and it will remain very local. So you need different solutions for different parts of the country for sure. Telemedicine, actually, and everything we can do for that, in my view, will be a very, very powerful application, in particular in rural areas. One thing we started doing this year is to enable you to actually not just have tele-urgent care, but tele-primary care as well. You'll be able to pick a doctor in the cloud, so to speak, who will be a primary care physician. That can be connected with, let's say, for example, wireless ultrasounds in your home that you can use yourself. It might be connected with other kind of sensor technology. We can read from afar remotely what's happening with you. Are you kind of keeping your weight if you have congestive heart failure? Are you taking medication? Are you sort of like adhering to the care protocols we advise you to adhere to? That will actually work very well in even rural, remote areas. But yeah, there will be different solutions, different parts of the country. In my view, what it comes back to really is healthcare is too complicated. It's too costly for everybody. And so if we can create a more seamless experience, the two of us together and other partners together, and if we can make it more affordable, those are the two key points that everybody suffers from right now, not having enough of.
Speaking of costly, drug pricing and policy has sort of taken a backseat to trade this year, but we're going into an election cycle, and I wonder how you think about pricing and policy going into at least the primaries next year.
Yeah, one of the biggest things that we've really focused on since we started Capsule is how do you make things easy for people to use? So more than pricing, more than the debate around, are drugs too expensive or drugs not expensive enough? We think the most important thing to start with is how do you make healthcare simple, easy, and transparent for people? And then the conversation is really about, do we have the right data? Do we have the right systems? And who's really sitting in the center point of the healthcare system to connect all of the different stakeholders that lets us really understand whether we're driving better outcomes or not. And so I think our focus has always been, how do we connect all of the stakeholders in healthcare? How does the pharmacy serve as the quarterback of the healthcare system and make sure we're partnering with really innovative companies like Oscar and other folks in the healthcare system to really understand how do what's going on day to day, and how do we drive those real-time feedback loops so we can have a real conversation about what drugs are working, what drugs are not working, and shifting the system entirely to a value-based model. And I think the things that Oscar and Capsule are doing are the very first steps of making that system come to life in the U.S.